Good afternoon. That's a tough act to follow. I'm here as the executive director of Westchester Disabled on the Move, and also as a board member of the New York Association of Independent Living, which is an organization of independent living centers based in New York State. We are strongly opposed to Assembly Bill 2383, which would, in our eyes, legalize physician-assisted suicide in New York State. I know that most national disability rights organizations are also strongly opposed to such laws. Self-described disability advocates who do not have disabilities really do not speak for our community. Look at the people in this room. Look at the people in wheelchairs who have chronic disabilities, who have a life in front of them. Also, as an addendum to my testimony, I provided with links to 3 YouTube videos of people with disabilities who are strongly, strongly opposed because it reinforces the idea and the negative perceptions about people with disabilities. People with disabilities, they're not mentally retarded, they're not cripples, they have lives, and those lives are worth living. Fears of becoming disabled and facing functional loss, whether the cause is injury or illness, are often reported by doctors in Oregon as the primary reason for requesting assisted suicide. Not pain, not insufferable pain. Earlier, Dr. Milch stated that suffering is an individual perception. I think that is true, that a person with a disability, let's say, who is not offered community-based services and face years of institutionalization, they're suffering, and they may choose to end their lives. And let's be honest, in this state and throughout this country, more and more people, and still people with disabilities, remain in nursing homes when they should be in the community. So, under the definition that Dr. Milch had given, people who have chronic disabilities would, in fact, be considered as eligible for assisted suicide. In addition, Mr. Pfeffer, when he talked about Huntington's disease, really does show that A 2383 will indeed create a slippery slope, an open door that could eventually include all people with chronic disabilities, people who are on respirators, who cannot breathe without those respirators. That doesn't mean their lives are not useful. However, yes, they are terminal if they take off that machine. So many people do acquire disabilities towards the end of their lives. We understand that becoming disabled and losing the ability to do things like walk and dress and go to the bathroom independently is extremely difficult and does create emotional depression. Yet the law doesn't have adequate safeguards to ensure that people who are seeking this option are not seeking it due to depression or other concerns which can be addressed. We don't believe there are adequate safeguards in the bill. So, as a matter of fact, the proposed Medicaid Medical Aid in Dying Act only mandates an attending physician refer the patient for a mental health screening if they lack the capacity to make the decision themselves. So if you're wondering why the disability community is so opposed, and yes, the majority of us are, to legally assisted suicide, consider the reports that came out of Oregon in January. They did confirm, Craig New, who was a research analyst for the Oregon Health Authority, who studies the Death and Dignity Act, said, the law is best seen as a permissive law and states only that patients must have a terminal illness within 6 months or less to live. It does not compel patients to have exhausted all treatment options first or to continue current treatment. It is up to the patient and doctor to discuss disease and treatment options. But if the patient decides they don't want treatment, that is their choice. So, in fact, terminal illness is fairly ill-defined, and it seems like it's becoming broader in the state of Oregon. So, NIAL is also concerned about the deadly mix between our profit-driven healthcare system and legalizing assisted suicide. It is often cheaper to end somebody's life than to provide treatment. I'm going to try to cut to the chase here and finish what I have to say. There are alternatives in New York. As our previous speaker said, why are we 48th in providing hospice care? If we are so enlightened in this state, why are we not providing the services that will make death and the process of death truly easier? People with disabilities, and all people, prefer to live and die in their own homes as opposed to hospital. Unfortunately, as I just said, hospice is not available for many people with terminal illnesses and is severely underutilized in New York. Finally, we are still very concerned about the potential for coercion and abuse based on the laws that already exist in Washington and Oregon, which have ineffectual safeguards against abuse. We have heard of many situations where families doctor shop until they found a doctor who is willing to prescribe. So we don't believe that A2383 prevents a coercive family member or caregiver from doctor shopping to find a physician who will provide a fatal drug. And there is nothing in the proposed legislation that would prevent an abusive caregiver or family member from steering the individual toward a physician-assisted suicide. Okay. There is no requirement that an independent witness is at the time of death, is there at the time of death. Thus, there is no assurance of self-administration or even consent. For these reasons, the New York Association on Independent Living strongly urged that the Assembly Health Committee not pass this dangerous legislation on to the full Assembly. Thank you. Any questions?
Yeah, you referred to many cases of abuse in Oregon and Washington. I would appreciate it if
in my testimony there are some examples. I try to cut short my testimony by not being specific.
Okay, so we would find those references in your testimony?
Yes.
Okay, thank you.